If you're awake, you're probably saying to me right now, napping, it's so good for the soul, but it could be really bad for your heart. Yeah. That's according to the latest research found in the Journal of the American Heart Association.
Yeah, naps are a part of life, especially when you work on this early morning shift. Let me tell you, I nap a lot, but the studies show it could actually increase the chances of developing heart disease. Well, here to explain why naps are getting a bad rap is the director of cardiac critical care at Mount Sinai Hospital, Dr. Umesh Gidwani, who also happens to specialize in pulmonary and sleep medicine. Dr. Gidwani, thank you so much for being with us.
Good morning. Thank you for having me.
Listen, I got to tell you, I need a nap. But when I read this study and found out that naps might actually be bad for me, I was blown away. So say it ain't so.
Well, it's not that easy. It's not that simple. So clearly, it is certain that fewer sleep hours are bad for you. There is incontrovertible evidence that it leads to coronary disease, cardiovascular disease, and so on. It is not clear, however, that napping or sleeping 9 hours or more is inherently dangerous, particularly for healthy individuals such as you folks. So if you're healthy, it's not clear that it's bad for you. In this study, and there are at least 2 or 3 similar ones, we have a classic scientific conundrum, which is causation versus correlation. In other words, does sleeping more lead to cardiovascular disease, or are there illnesses that lead to excessive sleepiness, and that is really a marker of symptom of illness?
And then there's the other question of sort of lifestyle, that if you're able to prioritize sleep, maybe also you have a lifestyle where you're able to prioritize physical activity, eating good, healthful food, that it's not just if you sleep less, you're going to die more or earlier.
Die more.
Or die more often, yeah. So, so you're absolutely right, Kirsten. You know, being sleepy or tired may be a surrogate for other things that cause, cardiovascular disease, such as, for instance, an epidemic of sleep apnea, right? So sleep apnea can lead to excessive daytime sleepiness, other conditions such as depression, or even medications that one takes for coronary disease or cardiovascular disease can cause excessive sleepiness. So, clearly there is some causation or some correlation, between excessive sleepiness and ill health. But one must look deeper for that then.
Let me ask you this, though, because there are days that I take 20-minute naps, and then there are days that I take 2-hour naps. Is there a difference between taking the effect of a power nap compared to someone that's, that naps for several hours, on how it can affect your cardiovascular system?
See, that's a great question, right? It is not clear that occasional napping, regardless of the length, is bad for you. In fact, there was a 2019 Swiss study that showed that folks who nap once or twice a week actually have a lower risk of cardiovascular disease. And in that same study, there was no association found between more frequent napping or napping duration.
So we're seeing some studies that are kind of butting heads a little bit in their information, which we get a lot in science. Let's talk about the 8 essential things that we can be doing and focusing on right now for optimal health. We've got a great graphic for this. We're talking about diet, physical activity, nicotine exposure, which I would imagine you would advocate 0. 7 to 9 hours of sleep, keeping your weight healthy, and controlling your cholesterol, blood sugar, and blood pressure.
Right. So just within the last 10 or 14 days, the American Heart Association revised what they called Simple 7 by adding sleep to now call it the Essential 8. And all of these are so important. And some people find it difficult to remember. So I'll tell you, it's really simple. There are 3 things that one must do. Have a healthy diet, physical activity, not a lot necessarily. If you do 150 minutes a week or 30 minutes for 5 days a week of moderate or greater activity, that's plenty. Good quality sleep, 7 to 9 hours. One thing that you must not do, that is exposure to nicotine. That will hopefully lead to the next 4, which is a weight under control, bad cholesterol under control, blood sugar under control, and blood pressure under control. So if these 8 things, very simple, 3 things you do, 1 thing you do not, leads to 4 simple things. If these last 4 things are not under control, one must strive to bring it under control by various means. See your doctor.
Yeah, so we're not really getting something that is so earth-shattering here. It's that we got to pay attention because we could end up with stroke and heart disease. Dr. Umesh Gidwani, thank you for shining the light.
I'm going to keep
keeping us
napping.
on the straight and narrow.
I'm on the nap team.
Thank you.
Keep on
Thank you,
napping.
Kirsten.
Thank you.